what further finding would most suggest this polyp was malignant? Lobulation. 36 HIV-positive man-positive stool culture for salmonella. Which part of the bowel is most likely to appear abnormal on CT? Right hemicolon. 37 benign hemangioma is suspected MRI. What would the most likely signal characteristics of this lesion be? Hypointense T1 and hyperintense T2. 38 patient with shortness of breath, ultrasound, thick-walled gallbladder but no gallstones. What is the most likely explanation for the gallbladder wall thickening? Cardiac failure. 39 increased periportal attenuation. 40 MRI lesion to be hyperintense on T1.
Experiment not finding अच्छा should not find following liver transplant increased periportal attenuation. ठीक है, याद करो. ठीक है, सिर्फ thick wall gallbladder but no gallstones ये नजर आता है cardiac failure में. MRI lesion is in hyperintense T1 and hypo on T2. For lesion most likely to reverse plan adenoma. ठीक है.
Weighted sequences and hypointense on T2 weighted sequences. What lesion is most likely to exhibit this pattern? Adenoma. 41 What modality is most sensitive in detecting liver metastases? MRI. 42 Via what route is it most likely that the fungal infection spread to the liver? Hepatic artery. 43 Known polycythemia rubra vera CT ascites. Caudate and right hepatic lobar hypertrophy with mosaic enhancement of the liver. Also a low attenuation 2 cm lesion in segment 2 which showed peripheral nodular enhancement. A delayed phase scan showed filling in of the segment 2 lesion, but the remaining liver enhancement was markedly delayed. Most likely diagnosis? Budd-Chiari syndrome.
polycythemia rubra vera में जो hypercoagulable level state होता है फिर इसमें Budd-Chiari होते हैं बस. ठीक है, यही Budd-Chiari की साइंस है.
44 Past aneurysmal history multiple myocardial infarctions. Subsequent coronary artery bypass surgery ultrasound a single ill-defined wedge-shaped area of decreased reflectivity within the spleen. Most likely diagnosis? Splenic infarct secondary to embolic phenomenon. 45 CT scan liver measures 65 Hu. What would be the expected density of the spleen? 40 to 60 Hu. 46 CT of the upper abdomen multiple wedge-shaped peripheral lesions of low attenuation within the spleen in both the arterial and portal venous phases. What is the commonest cause of this bacterial endocarditis? 47 abdominal radiograph multiple well-defined calcifications that were diffusely distributed throughout the region of the spleen. What is the most likely cause of this granulomas? 48 woman with suspected erythema nodosum ultrasound moderate splenic enlargement and scattered nodular lesions throughout the liver and spleen. What is the most likely diagnosis? Sarcoidosis. 49 What feature on the more recent scan would suggest a diagnosis of the more unusual emphysema-2 spolicystitis over simple acute cholecystitis? Arc-like hyperechogenic areas outlining the gallbladder wall.
25 calcifications in the spleen, तो ये granulomas. ठीक है, फिर आसान एर्थोमा नोडोसम के अंदर sarcoidosis में. ठीक है, what we are more recent scan what is the diagnosis of epidemic cholecystitis. Arc-like hyperechogenic जो outline gallbladder wall ये है वो air ultrasound पे है.
What feature on ultrasound would be more in keeping with sludge rather than a polyp? Non-shadowing and mobile. 51 CT pockets of air in the gallbladder wall and abnormal mucosal enhancement of the gallbladder wall with a small defect laterally. Most likely diagnosis? Gallbladder perforation. 52 ultrasound gas artifact echoes outlining the gallbladder wall. Nest likely causative organism. Clostridium perfringens. 53 scintigraphy was performed. What is the most specific sign of an impacted cystic duct stone? Non-visualization of the gallbladder by 4 hours. 54 Past medical history of a total colectomy following a diagnosis of a familial adenomatosis polyposis syndrome. CT and MRCP demonstrated double duct dilation. Most likely diagnosis? Ampullary tumor. 55 ultrasound bright portal tracts and a filling defect in the common bile duct. ERCP multifocal strictures and a string of beads appearance. Small saccular outpouchings were also visible. What is the most likely diagnosis? Primary sclerosing cholangitis. 56 Diagnosis of Miritzi syndrome. What radiological features would be expected? Fistulation between the gallbladder and common hepatic duct. 57 HIV positive US dilated thick-walled bile ducts. Diagnosed with an opportunistic infection. Most likely causative organism. Cytomegalovirus. 58 serum bilirubin was 15 ultrasound hyperechoic 5 cm mass in the lateral right lobe of the liver and dilated bile ducts peripheral to this area. CT mass to be hypodense and early rim enhancement followed by marked homogeneous delayed enhancement was visible. Most likely diagnosis? Intrahepatic cholangiocarcinoma.
पॉजिटिव में होते हैं अपने इन्फेक्शन से HIV में इनमें सारे इन्फेक्शन फिर होते हैं ये बड़े क्लिनिकल करना ये मास ही हाइपरटेंस से रिम एनहांसमेंट होती है रिम एनहांसमेंट होती है और ये है हेपेटिक cholangiocarcinoma
59 ultrasound a large cyst below the ports hepatis, which was separate from gallbladder and communicated with the common hepatic duct. Most likely diagnosis. Cholentical cyst. 60 diagnosed with ulcerative colitis. Ultrasound prominent right intrahepatic ducts with echogenic walls. Most likely diagnosis? Intrahepatic cholangiocarcinoma. 61 1-month-old baby girl with a persistent productive cough developed progressively worsening respiratory distress. Radiograph linear gas shadows were visible projected over the central liver. Most likely diagnosis? Congenital tracheobiliary fistula. 62 history of alcohol and drug abuse. CT gland edema. Inflammatory changes in the surrounding retroperitoneal fat and hyperdense areas, 50-70 Hu, within the gland. Most likely diagnosis? Hemorrhagic pancreatitis. 63 appendicitis was considered as a diagnosis. What ultrasound finding would be most supportive of this? Non-compressible tubular structure greater than 6 mm thick. 64 abdominal MRI 2.
Acrocarditis is associated with cholangiocarcinoma, ठीक है हमें प्राइमरी cirrhosis asymptomatic होता है तो इसलिए ये ऑप्शन गलत है ठीक है फिर और acrocarditis जब नजर आ जाए तो बस इंट्राहेपेटिक cholangiocarcinoma ठीक है अच्छा फिर नेक्स्ट ये congenital tracheobiliary fistula coronary cupping and a progressive worsening respiratory distress है फिर linear gas channels visible collect over the central liver ये congenital tracheobiliary fistula है क्योंकि इसको वन मोर बेबी गर्ल है और पोर्टल का respiratory distress है फिर HF drug abuse हमारे pancreatitis में होती है ठीक है क्योंकि hyperdense areas within the gland है तो ये हमारे pancreatitis में है ठीक है bronchitis ये non-compressible tubular structure है ये आसान है ठीक है 54
Lesions measuring 2.5 and 2 centimeters were identified in the pancreas. Hypointense on T1 and hyperintense on T2 weighted images, and there was ring enhancement after gadolinium administration. Most likely pancreatic pathology. Insulinoma. 65 CT. This showed edema in the peripancreatic fat and irregularity of the pancreatic contour. A discrete ill-defined area of low attenuation was seen in the region of the junction of the body and tail, and there was bilateral thickening of the pararenal fascia. There was no appreciable loss of gland volume and pancreatic duct was normal. Most likely conclusion. Pancreatic contusion. 66 acute severe pancreatitis was diagnosed.
हिस्ट्री में देंगे उसमें भी सिनेरियो में है कि जो है हाइपोग्लाइसेमिक एपिसोड्स पेंसिलोमा है ठीक है पैंक्रियाटिक कंफ्यूजन है आसान है ठीक है इसमें आरटीआई का हिस्ट्री होगी ठीक है ओरिजिनल एमसीक्यू पढ़ें फिर acute severe pancreatitis was useful for planning education for 24 hours ultrasound count pancreatitis के लिए ultrasound count करते पहले adhering to the expected findings acute pancreatitis there was exclusive pancreatic calcification and bilateral calcification for underlying diagnosis to hyperparathyroidism ठीक है फिर 68 CD4 enlargement of the pancreatic head the pancreas contained numerous irregular ductal calcifications की coronary pancreatitis ठीक है आसान है 69 CD gross abdominal ascites with a mean density of 45 most likely cause of this is 45 HU हाई डेंसिटी असाइडल सीनन अनचेन ओवेन ट्यूमर, फिर और ये फीमेल होगा, ठीक है, फीमेल की हिस्ट्री है. 70 child presented with hyperpigmented wheal and flared skin lesions, horizontal hypopigmentality and some enlarged retroperitoneal lymph nodes, bowel showed ileal wall thickening and distorted thickened node report in the ileum, most likely diagnosed mastocytosis. Hint ये कि wheal and flared skin lesions, ये mastocytosis.